Welcome, dear friends and colleagues. Welcome to a new edition of our webinar series. My name is Inés Valenzuela. I'm the product manager at Condor Travel. We're very happy to have you here with us again this week. This is a very important edition of the webinar series for us. We are living unprecedented times that present us with a series of challenges as an industry. Naturally, the aspect of health and safety is our top priority. We're committed to protecting both visitors and locals throughout our whole operation. And our team is continuously working hard to consolidate official protocols from governments, to define our own protocols and implement them. And these are the protocols that we're going to be covering today in this webinar. But we need to stretch out that this is an ongoing work, and all of your feedback is extremely valuable. Not only to continue to minimize risks, but also to manage the perceptions of risk that travelers might have. We want to offer you and offer your clients timely information and anything else that we could provide them to give them greater peace of mind in this regard. We have a very big team with us today from our different offices in South America that are going to be sharing their knowledge about protocols and about official documents so far. Presenting will be Ángel Grandez, our Regional Operations Manager, and we will have a complete team of operations on our Q&A section on the right-hand side of your screen. So please do share with us all of your questions, doubts, suggestions, and our team is going to be answering as the extent as we can with the information that's out right now, and anything that we can't cover during this webinar, we're going to follow up later on. Again, this is an ongoing work, and we estimate this is a first edition of many other updates that we will be having as soon as official protocols from governments keep coming out, and we keep refining our own protocols as well. So we will have Desiree Bejar, Operations Manager from our Peru office, as well as Marilia Ricalde, Operations Supervisor for Cusco, and Luis Collantes, our Transport Manager for Peru. Also from our Ecuador office, Silvia Fiallos, Operations Manager, and Paola Sandoval, On-Tour Manager. From Chile, we will have Cintia Cipion, our Operations Manager. From Bolivia, Denise Elio, also Operations Manager for Bolivia. From Brazil, Joao Saravia, Operations Manager. And from Argentina, you might know him already, Martin Perez, our Country Manager. So without further ado, I will leave you guys with Ángel, who will be presenting our webinar for today. Hi, Ángel, how are you?
Hi, Inés, thanks for the introduction. I'm good. I think I need to switch. All right, just a moment. I'm going to share my presentation with all of you guys. Okay, so I just want to make sure that help me out, guys, behind the scenes. Yes. Can you see the? All right, cool.
No, we're seeing your moderator view.
Oh, sorry. Just 1 second. What about now?
Okay, right now we see it in a regular view. If you could put it on full screen.
Okay. Better?
It's still on presenter view.
Sorry.
Technical issues. Okay, now we have it on full screen.
Okay, cool. All right. Once again, thanks for joining us on our webinar, Wednesday webinar. As Inés already introduced, we have the whole team, the operations team behind the scenes that are going to be there ready to answer your questions. So I just want to start before we dig into what we actually are going to go through today. I want to make sure we all remember and we all go like a little bit 3 months kind of ago when all this crisis touched South America, and having travelers in destinations, Condor Travel took preventive measures to face this COVID-19. So which later on became part of what nowadays we are seeing or calling protocols here and there. So all these measurements that we actually took while having travels in destination were like social distancing, hygiene, the use of masks, among others that were implemented in all our tours. So you must remember that the lockdown started in South America during the month of March. So while the quarantine was declared by presidents in South America, we had travelers in destination. So in all South America, we had, this is a big number, actually, we had over 1,500 travelers in destination. Just to set an example, talking a little bit about Peru, Peru had about 1,400 travelers in destination from 33 different nationalities around the world. So that was a big challenge for the ops team to make sure that they all put hands on in order to start evacuating these travelers back home. So I call this moment hands-on, as I said already. All Condor Travel staff work tireless together with our regional offices, tour operators around the world, clients from all our corners in the world, travelers themselves, in order to get them on these humanitarian flights that different embassies started to organize in order to repatriate their travelers. So, and not only that, we got in contact with all these embassies in South America to ensure that all these travelers are mapped out and are in their list, because that was like crazy. Links here and there in order to fill out them to make sure that all travelers are in their register in their embassy. So that was done also by the ops team here in South America. So step by step, different countries, different embassies started to organize the repatriation of the travelers. Believe it or not, while all this event was happening, phone calls with our travelers 24/7, phone ringing here and there. People had to move, pick up their computers, whatever they had in the office, move to their homes, because remember, the quarantine was already declared in South America, and they had to establish their small office at home from where they were working. So I just wanted to make sure that we all know that this is something that I think put our company in a, I would say in a different level because of the volume of travelers we managed while this crisis happened during March and the beginning of April. So a big shout out to all these amazing people that work together with us, with you guys, and happily we think like the next 10 or 2 weeks since the quarantine, the lockdown was declared, we had all our travelers back home. So just want to make sure that this is mentioned and that you could know that you got an amazing team that you could trust in the future. Hopefully this doesn't happen again. So we started to get certifications, even though that the protocols are not like officially established in countries in the region of South America, but we started to get these certifications. For example, Brazil got already their certification, which that means that that's official certification from the Brazilian government, which means that they actually are ready to reactivate. We're ready to reactivate our business in Brazil. So That's something that we should feel proud of, that our office in Brazil is ready when everything should be ready to start running tours there, according to official protocols. So we also applied to the WTTC, the World Travel Tourism Council, in order to make sure that our internal and private Condor travel protocol matches with all their needs, with everything that they were requesting. So we applied, we filled up a few forms here and there, and I could actually proudly say that this certification gives us also not only the fact that we got the certification, but we feel committed in our region and in all levels, top level CEOs and everybody included, that these certifications give us even more responsibility to continue working responsible locally and in international standards. So I guess we're going to be getting more of this if that's something that we should be officially applying, and without forgetting that in each country we need to have our official and legal protocols, as we already mentioned. So why a protocol? That word, I think it's already overused in the industry. In different countries, we've seen webinars here and there that they talk about protocols, but I think number one reason why we need to use this protocol is for legal matters. Authorities and the governments have established these protocols here and there, and some of them already exist in order to formally, officially, legally reactivate our business. So, but this is what the protocol means to Condor Travel, and we're going to start now talking about how the protocol at Condor Travel looks like. So we have this field staff protocol, and this protocol is for basically the operations that we run in South America. So this applies for guides, reps, tour leaders, and everybody on the field facing our clients. So we all know that not all protocols are officially launched. I'm going to be mentioning this because this is a private protocol for the private sector. In this case, Condor Travel has designed this protocol, and it's not an static protocol. This protocol is going to continue to be growing. We're going to be adding things here and there according to what local authorities require. So this is version 1 that we're going to be showing today. And of course, we do appreciate your feedback because this should be done also together in a responsible way, for sure. We went forward and following existing protocols and also following international guidelines where the industry is getting ready to go back to the new normal. I already mentioned about Brazil. So we got together with all our South American operations team in order to design this protocol, this version 1.0, number 1, I would say. We also talk with our guides because they are the ones that are going to be facing our clients, our travelers here and there, and so we ask them questions, we gather feedback, and they were a big part of this of designing this protocol as well. So as you could see, this was done not only for the team that Ines already mentioned, this was also done together with the rest of the departments and our field staff. So let me show you a brief of our field staff protocol first. So the objective, we always said that we cannot operate or run our tours if the path is not safe or secure. I think that is priority number 1 for our organization from the operations point of view. That's our main pillar, and this protocol cannot be an exception. I think we have to be consistent with this message. So we are consistent with our message that this is why more than ever, our goal and number 1 objective is health and safety for our internal and external clients, our staff, guides, and so on, as well as for our travelers. Before, of course, everything that I'm going to show you, it's before, during, and after the development of our operations of our tours. That being said, I want to make sure that we all remember that the protocols here and there have, according to what we have seen, we have searched here and there, three main pillars. One of them is social distancing, the other one is PPE, personal protection equipment, and hygiene. We've seen the World Health Organization, as well as other ministers of health around the world or in each destination. They mention these three main pillars that we have to keep this in mind at all times. So protocols are kind of based mainly on these three main pillars. So we have to apply them in our operation activities, in all our activities that we do while developing these tours. So at all times, we'll make sure that our staff on field, guides, tour leaders, reps, keep social distancing while on tours, by the way. So 1 meter or 3.3 feet distance is what we do at least recommends, to respect between people, between tourists, between visitors. So it is going to be hard, of course, to maintain this, but yes, this is not enough because we could implement our protocols, and I want to make sure here that we all know that landmarks such as Iguazu Falls, Galapagos, Patagonia, and different cities, different museums, public or private, are going to be putting together the protocols to make sure that tour companies and travelers do respect them while visiting those places. I'm going to set an example here talking about social distancing, what has already been announced in Machu Picchu last weekend. So last Friday, the chief of the park at Machu Picchu, they announced the following measurements, the following highlights of what the protocol is going to look like. 7 tourists with 1 tour guide. So, and while in the city of Machu Picchu, while in the Inca city of Machu Picchu, they should keep 20 meters distance from group to group. You see that the social distancing is between and among the group itself, and also with the rest of the groups that could be visiting a park, a big open area like Machu Picchu. So 75 tourists visiting Machu Picchu per hour. That's something that we also be considering. So during the day, less than 700 travelers visiting Machu Picchu, which officially, according to law, will be open on July 1st. But I have to make sure that we all know that this is first opening for the local tourism, because the borders are not open yet. So there will be in Machu Picchu 2 main routes. The most famous one, the one that everybody knows, the long one, the one that starts at the guard's house in the famous lookout of Machu Picchu and go down through the city and turn around and you get out. That's going to be implemented with these protocols. And the short version, the short route of Machu Picchu, which is just in the lower part, you get to walk only for a few I would say the tour could actually last a bit longer, but you just tour around the lower part, the main platform down there, so we could actually have also a good view of the city. So these 2 roads are going to be open with the protocols that Machu Picchu will be announcing shortly. So not only that, because Machu Picchu has other links. The bus that goes up and down Machu Picchu is reduced at its 50% according to law. So 16 people going on the bus from Aguascalientes, from the town below, up to Machu Picchu. Also keeping social distancing at all times. What does that mean? That in a bus bringing 16 people, there are going to be two groups. Okay, 14 travelers, two groups of 7 plus 2 tour guides that are going to start the tour in the town of Aguascalientes, take the bus, go up to Machu Picchu and start touring. There's not going to be like the entrance of Machu Picchu. The idea is that not to have it crowded and to keep this social distancing at all time. Bordering the bus and entering to Machu Picchu. If we go a little bit to the train scenario, the trains also are going to be measuring and having all this same protocol. Trains are going to have 50% of its capacity, and all this dynamic is going to be consistent. They are working together, and they're also working with us to make sure that we are all in the same page. I just want to address this because this is something that happened and was announced and is in social media since last Friday. So you have it there. Once we have more news, for sure, we're going to be sharing everything with you. So stay tuned for that. And not only Machu Picchu, Galapagos also will be start opening up on July, as well as other landmarks in the region are going to be opening their doors. First to regional tourists, and then, of course, when borders are open to everybody, welcome to back to the new normal. Okay, so hygiene and considerations before we start a tour, before we start any activity on the field. Guides, reps, and tour leaders must not present any sign of COVID-19 disease, such as fever, sore throat, and anything that corresponding authorities have indicated. We're going to make sure that this is mapped out. Not having been in direct contact with people that have the tested positive for coronavirus. Wash hands at all times. Leaving a place, leaving home. When going to work, hygiene guide has to present himself, making sure that these previous considerations are taken in action. Wear a disposable mask, or not only that, a mask itself, just bring extra because that could be used, could be needed later during the tour. So that in order to avoid spreading the coronavirus. So avoid using accessories such as jewelry, caps, watches as whenever possible, right? To also reduce to minimum this spread of the famous coronavirus. At the beginning and by the end of a service, they have to make sure that they do an auto triage and report immediately to the office. So this is something because they will later could be starting another tour, let's say, so they have to be checking themselves at all times and also with our travelers. So wear the right type of clothes to provide, if there is something that the government or local authorities do recommend, the tour guides, tour leaders do have to wear while running a tour, we're going to make sure that this is respected. Maybe it's not going to look good or whatever, but we'll do whatever the authorities say, as I already mentioned. For the use of public transportation, we know that our staff here and there, they're going to be using the public or private transportation. We have to make sure that they do use designed and authorized type of transportation when moving from A to B, for example. In case of if a field staff, if a on-field staff or guide, rep, tour leader doesn't feel well, feels a bit ill, or with any of these symptoms, As I already mentioned, they have to report immediately to the office to activate our crisis management plan and to provide support, and of course to reschedule or change the guide to keep on going with the tour. Prior to the service, the guide must coordinate and inspect the rest of the suppliers. For example, when before facing our travelers, they're going to get in contact with the driver. So they have to, guide also has to go. They're going to have a checklist where they have to, make sure that everything that we're going to need for our transport or any supplier, guys also need to be checking and reviewing. So yeah, this is and this actually continues. Carry a personal first aid kit and protection gear in good conditions. That's a must. And inside of this backpack or suitcase, ideally a container such as a case or a Tupperware, where they actually need to put any personal belongings. Must be presented starting of the tour at least 30 minutes before the tour starts, before the flight arrives, before the train arrives, for example. Again, there must be a meter, at least a meter distance between tour guides and the rest of the people that could be waiting for travelers, either at train station, airport, port, or at the hotel, for example. No? But it doesn't have to actually minimize our guide. Shouldn't generate trust with our travelers. So before starting the tour, for example, once the group is already on the bus, the guide must fill in the clients about safety protocols that will be required to develop the tour. And make sure that they do understand that this is something formal, something legally, and that, as I already mentioned, it's for the safety and security. The guide will provide documentation, ticketing, anything that travelers will need for that day of the tour or for the following days, following the protocols. Could be an airtight bag or a Ziploc, disinfected and closed. So under the suspicion of a positive COVID within the travelers, within the group, it must be reported to the office to activate once again our crisis management plan protocol as well. The guys must respect the biosecurity, biosafety protocol of every establishment they visit. We do have our, you've seen this, we all do have our protocol, but also I mentioned landmarks, tourist attractions, as well as hotels, restaurants, public and private spaces are going to have their own protocols. So we have to make sure that our guides do know them in detail to deliver those protocols to our guests, to our travelers before entering to those places. During the service, the use of whispers or similar. By the way, this is something that I want to hear your feedback or put your comments on the chat box. So what do you think about if we do implement some sort of whispers or audio guides to make sure that these are tools that could actually give us a better resources to run our tours, keeping social distancing and so on. So we are actually checking this and working in order to understand how this actually could be implemented, as well as considering other sorts of technology. So we would love to hear your feedback on these and your comments if this is something that your travelers would find interesting. So let us know. To finish on the tour, guides should enter to the system and fill out the report. So this report that we've been talking about doesn't have to be filled out only at the end. Only if there is an emergency, guys should not only rely to the report. they also have to call whenever there is an emergency. Okay, so in a transfer in, this is another scenario. It's something similar to the other one, but I want to make sure that you all know what actually we're going to do while on the transfer in. The guide will locate himself and use a sign that big enough, visible enough to establish contact with our clients. The guide will keep social distancing again at all times with passengers, with everybody surrounding them. The guide will verify that the travelers has the personal equipment, the PPE, and will proceed with the triage before leaving the airport, before leaving the port, the train, and before entering on the bus. So before boarding the vehicle, the passengers and staff will disinfect their footwear. The bus will have hand sanitizer at travelers' disposal and signs to indicate how the seating distribution is going to be according to each type of vehicle. So briefing, the guide will once again ensure that travelers has all the information required, such as documentation, etc., and deliver them carefully in Ziplocs or tight bags according to law, and well disinfected for sure. Once arriving to the hotel, group must follow once again the hotel or any establishment they're going to be drop off their protocols. Once the service is finished, guide must fill out a virtual form again. We want to map out. We want to have all reports from all our activities that are going to be happening on the field. So during the tour, once again, before leaving the hotel, kind of like mentioned this briefly before, they have to verify passengers' personal protection. Once again, inform biosafety, biosecurity norms required to follow in the tourist sites, landmarks. Each traveler will go through a routine triage. Our guides will be trained, and we're also thinking of finding, once we know what organizations are going to be certifying guides, could be the first the Red Cross, for example, to make sure that our guys are well trained in order to do this triage routine whenever necessarily. The bus will have hand sanitizer. This is going to be in all our activities. Before boarding the bus, travelers and staff will disinfect their footwear before stepping on the bus. During the tour, again, 1 meter at least, a social distance. Once arrived to the hotel, once the tour finishes, either at the hotel, restaurant, anywhere, the protocol established by the place where the tour is going to be finished, they need to know what the protocol is there. So our guys are going to be also delivering this type of information. And once again, fill out the forms at all times, and in case if there is an emergency, boom, phone call immediately to activate our crisis management protocol. During transfer out, this is something similar. Our reps, our guides will verify that all travelers have personal protection equipment before boarding the bus, before leaving the hotel, and we'll also do the corresponding triage before leaving the hotel, before boarding the bus. Once again, disinfecting footwear. The bus will have hand sanitizer and everything else that we are going to need while bringing people from here to there. When arriving at the airport, respect the established protocols that the airports have developed. So here, talking about airports, we know that South America is a big region, and we do fly not only from capital to capital, we also fly internally, and we do domestic flights. So, for example, if before this COVID-19, we had to be at the airport 2 hours before to catch a domestic flight. Now it has to be a little bit longer. It could be 3 hours, not 2 hours. For international flights, it was 3 hours. Now it has to be probably 4 hours. So we have to keep an eye on this in order to share these details with everybody as well once the airports are running and started to operate in the new normal. So once again, by the end of the service, fill out the form. This is important for us. We want to make sure that this is all mapped out, because later on we could have requests regarding to this matter. So as you see, these are the three main factors that I have been keep talking: social distancing, hygiene, and the use of the personal protection equipment. So these three pillars need to be used at all times in all our activities. So you are going to be actually getting. This is a brief of what we have done internally. You're going to be getting from our team a full manual, like a full protocol with details. It's like a 25-page, where you're going to be seeing and reading and relying to this manual whenever needed. So this is going to be updated, as I already mentioned, and we're going to let you know once we do update this according to local and authorized protocols by law. But so far, we believe that the protocol that we designed, this is how it's going to look like when the government do release the official protocol, because we have been talking internally in the tourism trade here in the region, and we do understand, and we have seen carefully, and we were part of when the government socialized the upcoming protocols that they're going to be launching soon. So I don't think there's going to be much to change, but stay tuned. So you're going to be having this manual. Stay tuned for that, and I believe the team already shared. If not, you're going to be getting that with more details of what I already mentioned. So we also have at Condor Travel, we also have the adventure department. There we do have biking, horseback riding, kayaking, as well as trekking. So trekking, we think the adventure protocol is going to have its own space, its own protocol. So this week we are going to be sitting together with the tourism trade in order to propose the trekking protocol to the government, and hopefully this also could be ready during the month of July, because in areas, and I'm going to rely again in Machu Picchu in Cusco. So on July 1st, I mentioned that Machu Picchu is going to be open for the local tourism, as well as the short version of the Inca Trail. The one-day trek of the Inca Trail is going to be open as well. So, but I want to show you more or less how this protocol is going to look like. The adventure protocols are also being on the loop, as I already mentioned, right? And they're going to be ready soon. So we'll share with you guys. We want to mention that these three main pillars have to be applied also to this protocol. It's going to be hard. Yes, it's going to be hard because we got to remember that while trekking, we're going to be outdoors, and yeah, social distancing could be actually something that couldn't be an issue if travelers just trek themselves. But we got to remember that they don't trek themselves in places like the Inca Trail. They have to go with porters, with cooks. So how are they going to be keeping social distancing? And if we know that there is a limit number of travelers per campsite, so all these are already in the loop, and we've been working already to see how we're going to implement later on these protocols, not only for travelers, also for porters, for cooks. I believe they're going to be having their own protocol as well. So that being said, you can see here on the slides tents. So far we know that there's not going to be allowed to share a tent. So one person per tent, okay, and keeping also the social distance among tents. What's going to happen when arriving to a campsite and when the group of travelers need to go to the dining room to get their meals? So they have to go per groups, to maintain this social distancing. And also there is another possibility that they could be actually be having their meals at their tent. This is just ideas for now. However, some of them, like social distancing and having one person per tent, are kind of official. So once again, I didn't want to lose this opportunity to mention that we're also working with the tourism trade and the authorities to have this trekking protocol as well as the other ones ready. So what's going to happen in terms of hygiene? Are we going to be bringing everything ready and prepared, knowing that there is limitations for weight in certain places? No, we're going to train our team, our cooks, our porters, our guides, everybody that needs to be trained in order to know how to clean well every utensil, every gear, everything that we're going to be using while trekking at all times. So stay tuned for the trekking protocol that we're going to be working with locally with the authorities. And once this is ready, we're going to be sharing with everybody. So I also mentioned about trainings. We're going to be training all our guides, everybody on the field, as well as office staff with these protocols and going into details. We do not have the competencies to basically certify them, but we're going to bring organizations that do have all these requirements, all this capacity, I would say, to do certify our staff on field and office to make sure that they also train well, and not only once. We're going to be doing this frequently during the year to make sure once we start to gather and to receive travelers and guests from all around the world, we are 100% ready to work. So that being said, I also don't want to forget that the protocol is there, and once the protocol is officially certified, it doesn't mean that okay, we're ready. Let's start working. No, we're going to do a wide march. We're going to test first with our guides. 1, 2, 3, 4, 5 times, as many times as possible, and believe me, to make sure that everything is mapped out while on the field, and we don't miss any detail. So just want to make sure that everybody is informed of that. So what happens when there is someone, either a staff or a traveler with the coronavirus symptoms and kind of detected and with the coronavirus. So we do have, not sure if you have heard already, but we have our crisis management protocol, and this is not only for coronavirus. This has been already for a while in the organization, and we do added another incident that's basically pandemia. So together with the training that I already mentioned, we do have all this mapped out already, all this process, what we have to do once someone is detected with coronavirus. And that means informing the hospitals, doctors, and so on, as well as, of course, embassies if needed, tour operators, and of course, us involved 100% there. I'm going to also go through a few more slides, and we're going to talk about transportation protocols. This is also important to mention because this goes together with everything that happened on the field. Okay, so we do have developed already our land transportation protocol, and this is how it looks. So washing and cleaning, again, hygiene, external and internal. We have to make sure that everything from outside the bus has to be washed, clean, using any sort of solution to disinfect all the surfaces of these buses, these cars, as well as internal washing, cleaning the entire saloon and the driver's cabin, cleaning of the protection barriers, any surface, as I said already, disinfection of the bathroom with bleach, cleaning or similar, cleaning the railing luggage racks with alcohol or similar, cleaning the dashboard, steering wheel and microphone. This has to be done by the driver and by the guides, right? Mopping the floor with a mix of water and quaternary ammonium. Let's guys read this together because this is quite good, actually good information. Activate the air venting system during the whole washing tasks, disinfection of head rests, the seat, the seating, as I already mentioned, with alcohol. Once the process is completed, close the bus and place a security seal on the washed unit to make sure that this car is ready to go and it's disinfected according to protocols. So all cleaning rags must be washed and disinfected once the process is finished. Not only that, because we could wash and we could wear masks, everything that authorities will actually request and everything that we mentioned in our protocol, but where all this is going to go when they turn into trash. So we also are going to have appropriate bins or trash baskets to make sure that everything goes according to the specific place, the appropriate bins. So once again here, our drivers need to follow the same sort of rules before entering to the unit. Hand washing, put a mask and face shield to be used in all services, cleaning shoes before entering on the bus, cleaning mobile phone before even entering on the office where our buses are going to be placed. Once on the bus, activate air conditioning system for air circulation, cleaning of rudder and key of the buses and everything else that drivers do touch in order to do the driving. During a transfer, during a tour, this is basically pretty much the same. Place racks where people are going to be, even drivers, people are going to be cleaning their footwear before entering on the bus. This is already mentioned. Passengers should be seated according to the seating distribution. No, remember that units are at its 50% of capacity. Luggage should be placed safely in the holds. Luggage is not allowed inside inside the bus. But yeah, day packs, purses, any like something small are okay. Remove the rags and put them in a bag. Apply sprinkler with water or any solution to disinfect hands with alcohol at all times, as well as washing hands whenever possible when arriving to a place that has all these facilities. Activate the air circulation system during the entire road. So this is for a transfer in, and something similar, equal, is going to be done while on an excursion, while on a tour. So this is also something that I don't want to actually go farther into details regarding to what we're going to be doing with the drivers of the bus, but same sort of process, same sort of actions are going to be done regarding to the transport protocol. Standards, I already mentioned, for example, here in Peru, the Minister of Transportation already declared that all sorts of transportation, land transportation, have to be at its 50% capacity. For example, if a bus has 44 seats, now they have to, they're going to be filling them up with travelers at its 50% capacity. In other words, with 22 travelers, and maybe not 22 travelers themselves, but 20 travelers plus a couple of guides or so on. So I just want to make sure that this is informed, this is mapped out, because this is what has formally, officially been announced by in this case, by the Peruvian government. We got to stay tuned on what's going to happen with the rest of the countries in South America to see how their land transportation protocol is going to look like. So this is in a brief what our protocol is going to look like. Once again, you will be receiving a full detailed manual with more information regarding our protocol that you could actually go and check whenever necessary. So I want to also take the opportunity to remind you about Condor Assistance. So everybody knows about Condor Assistance. If you don't know or you haven't heard them yet, talk to your key account manager. They will be informing you more about Condor Assistance. But so far, just as a reminder, we know that Condor Assistance is our exclusive, nobody else has it, I believe, exclusive primary emergency assistance program here at Condor Travel. It offers guests easy to use immediate attention service in case of illness, not only for coronavirus, illness or any discomfort while traveling. Could be altitude sickness, could be any illness that, while traveling, any traveler could actually face. So this is just to remind you what Condor Assistance is and what do we have. So ladies and gentlemen, this is not enough. So we've been working hard to make sure that we do have more facilities, more exclusive product in the Condor Assistant line for everybody. So let me introduce you our Renew Condor Assistant product. Yes, it's Renew, and it's included for all our travelers. So this is something that everybody should know. And let's read together, because I don't want to miss anything that this Renew Condor Assistant has. So maximum global coverage, $4,000 US. So double of what the previous Condor Assistant had. So the first one had 2,000, this has 4,000. So up to 2 medical consultations at home or at the hotel. Doctor will go to the hotel, will go to wherever you are, in order to provide you a medical attention. Dental care up to $200, outpatient medication, any source of medicine that you could be needed or any trouble could be needing, $400, emergency hospitalization expenses up to $1,000, health transfers in the country within destination, $1,800, assistance in the event of lost, stolen documents or luggage, as well as included, and luggage location assistance too. So this is great, isn't it? I believe this is a plus. You know, we want to make sure that you do have you also inform about this new renew Condor Assistance. So and this is included for all our travelers. That's amazing. We also have our additional upgrades options. If anybody wants to know a little bit more about having an upgraded version of our Condor Assistance, so we have a couple of them, and let's read this together because this is very important. Maximum global coverage at $40,000, medical assistance in the event of accident up to 40K, dental emergency up to $500, medication up to $800. It's higher than the regular Condor Assistance. Medication during hospitalization included. Sports up to 10K. $10,000, and this relies, for example, this could actually match very well in our outdoor activities. We were talking already about trekking and stuff like that, so this is a great option. Health transfers included, repatriation as well as included, sanitary or funeral, hotel expenses resulting from a mandatory rest after hospitalization. Daily limit of money, $180. Total limits, $900. Wow, this is really, really nice. Rate difference for delayed or anticipated trip back home also included. What about the 60,000 coverage? So medical assistance in the event of accident up to 60,000. Of course, dental emergency 500. This is new. This is different from the other version, from the other product. Outpatient medication up to $1,000. Medication during hospitalization included up to 10. Included as well. For sports or any outdoor activity, $10,000. This is different. This is new. Prostheses and orthotics up to $2,500. Health transfers included. Repatriation included. Return trip of compensation of a repatriated traveler included. Transfer of relative included. Wow, these are really cool. Family members stay per day, $100, maximum $400, and hotel expenses during from mandatory rest after hospitalization daily up to $180 and total $900. Here we got a few other ones, accompanied of minors or elderly included. Wow, early return of serious accident home included. And once again, rate difference for delayed or anticipated trip back home included. So this is something unique. This is, as I already mentioned, this is exclusive for our Condor travel clients. And yeah, so if you want to gather more information about these upgrade options or the existing upgraded already Condor Assistant, by the way, contact your business and sales manager or your key account manager for further information. So that being said, I wanna Thank you all for tuning today, and stay tuned once again for everything else that we're going to be, gathering, and all the protocols that are going to be developing and designing by our governments, and of course by our operation team here at Condor Travel. Thank you very much, and I hope you had enjoyed this presentation.
Thank you, Uncle, for a very thorough presentation. We know we're certain that there will be doubts, questions, requirements of information. Please do share all of your questions with us. You have the contact details here for the market managers for each of your markets. So we will be sending these details out along with the recording of this webinar and the presentation as well to you later on. And we know that your information is very important to continue to develop these protocols. So we will be sending out as well a short survey to collect all of your doubts, suggestions, ideas, and to keep developing and refining these protocols to keep us all safe. So just remember, this webinar will be along with all of our other past webinars on our condortravelcontent.com/post/webinars landing page. So please revisit these. We'll be having this webinar uploaded in the following hours. And only, just so you know already, next week, I'm not sure if it's coming right. Just give me 1 second. I'm going to reshare my screen. Next week, we have Bolivia, our webinar about Bolivia Adventure with Sebastián Grisi, our country sales and marketing manager for Condor Travel Bolivia. So please do register. The registration link is already published on the Q&A section. So that's it for us this week. We hope this information was of value for you, and we will be doing updates on these protocols and probably doing some more webinars in the upcoming months as well. So thank you very much, and see you next week.